How to lower and control high blood pressure levels. Weight, lifestyle habits, stress, and medication can all contribute to hypertension. Discover ways to treat high blood pressure effectively. High blood pressure, also known as hypertension, happens when it takes too much force to push your blood through your arteries, making your heart work too hard. More than 1.2 billion adults worldwide have high blood pressure, and almost half don't know they have the condition. High blood pressure raises your chances of having heart attacks and strokes. It's important to know your numbers because if you have high blood pressure, you'll want to bring those numbers down. You can take your blood pressure at home with a blood pressure cuff or get it taken at your doctor's office. Blood pressure is measured in millimeters of mercury, mmHg. The American Heart Association ranks high blood pressure in 4 categories: normal, elevated, stage 1 hypertension, and stage 2 hypertension. If your blood pressure is ever greater than 180/120 mmHg, it is considered a medical emergency, and you should get care right away. It can take 1 to 3 months of regular exercise to see your blood pressure start to go down. If you change your diet, you might see your numbers drop in a couple of weeks. Taking medication will help you lower your blood pressure in about 4 to 6 weeks. Lifestyle changes may be enough to get and keep your blood pressure under control. If it's not, you might need medication too. It's important to take it exactly as your doctor prescribes, so don't cut doses or skip days. Medications used to treat blood pressure include diuretics, beta blockers, alpha blockers, ACE inhibitors, ARBs, vasodilators, calcium channel blockers, alpha-2 receptor agonists, and combined alpha and beta blockers. If you don't want to take medication or your blood pressure is just slightly high, there are a number of foods you can eat to lower it naturally. Your doctor may suggest you try the DASH diet. DASH is a well-known, flexible eating plan meant to help you manage and lower blood pressure. The plan recommends eating plenty of foods packed with vitamins like potassium and magnesium. You should have no more than 2,300 milligrams of sodium a day on DASH, but you may see better results if you have no more than 1,500 milligrams daily. The DASH diet suggests staying away from certain foods. It's a prime offender in raising blood pressure. The American Heart Association recommends that people with hypertension keep it under 1,500 milligrams a day. One way to cut back is to prepare your food at home. Eating more potassium helps move sodium out of your body. Here are ways to cut down on salt and add healthy flavor. Check labels for salt, sodium, sea salt, and kosher salt. Some juices like beet juice and ones high in potassium can help lower blood pressure. Just be sure to limit how much you drink because most juice is high in calories. Tea has healthy compounds thought to reduce inflammation and help your body use nitric oxide. You can bring down your systolic blood pressure by limiting yourself to 1 alcoholic drink a day. It's also a good idea to limit caffeine intake, sugar-filled drinks, and energy drinks. Research shows that some vitamins and minerals may help lower blood pressure. Before taking anything, talk to your doctor and be sure they know about all of the medications and supplements you take to avoid any interactions. When you exercise, you strengthen your heart. The stronger your heart is, the less force it requires to pump blood, reducing the pressure on your arteries. Aim for at least 30 minutes of exercise most days of the week. Regular physical activity may lower your blood pressure by 6 to 12 systolic points and 3 to 7 diastolic points. Exercise can also help you lose weight, which can benefit your blood pressure. If you're overweight, losing as little as 10 pounds can help lower blood pressure. Plan to shed pounds slowly with a steady mix of healthy eating and exercise. Lowering your stress helps keep your blood pressure normal. Try mind-body exercises like yoga and Tai Chi. Meditation can also help with stress, as can listening to calming music. Other things you might try to get a handle on stress include setting realistic daily goals, controlling what you can, staying clear of stressors, finding some me time, and seeking therapy. Swearing off cigarettes is probably the single best thing you can do for your heart. Not only does smoking hurt you over the long term, but your blood pressure goes up every time you have a cigarette. When you are sleeping, your heart rate, breathing rate, and blood pressure usually go down. If you don't get enough sleep, that means your blood pressure remains elevated. If you find it helpful, please share with your nearest and dearest one. Thanks for watching. Don't forget to like and comment. Please subscribe for more.